Hello friends, Namaskar. I am Dr. Yashwant Joshi, the Vice President of NAPCAIM, that is National Association of Palliative Care for Ayush and Integrative Medicine. Earlier, we discussed about the reaction, psychological reaction of the patients whenever a disease is diagnosed and it is being told to them. And it's very unpleasant, when you hear about the disease. So they come in the denial mode. Here the picture on the first slide is the picture of an ostrich, a bird generally found in desert. Ostrich also buries its neck whenever sandstorm comes around, and it's a very unpleasant thing, and buries the neck, eyes, everything, and just remains, thinking nice, nothing is going to happen to it. Exactly the same situation, ostrich mentality we say, that the people, they deny whenever any unpleasant situation is going to come against them. And diagnosis, proper diagnosis and the disclosure of bad disease is always an unpleasant to anybody. So firstly, I'll just take handling distress. Distress and denial, they generally go together. What is distress? The word distress has many meanings. Distress is an unpleasant emotion, feeling of thought, condition or behavior. It is unpleasant. Every time distress is unpleasant. Maybe a feeling, maybe a thought, maybe a condition, or maybe the behavior. Your own behavior or others' behavior. Distress can affect the way you think, feel or act and can make it hard to cope with having cancer along with dealing with symptoms, treatment and side effects. Here the distress starts when cancer has been diagnosed. So the first thing what happens, the patient comes under distress because normally what is believed, cancer means cancel. This particular disease will cancel your life, you will die in near future. So in such a situation, before death, you generally go through the ideas what is going to happen to you, what will be the treatment like, what are the side effects of cancer. You have seen patients socially somewhere, some of your friends, So such thinking, such thought process in your mind puts you under distress, a sort of psychological reaction. Research shows that distress may affect how you make decisions and take actions about health too. Now, it's everybody's experience that we are not positive mentally, we cannot cope up with the situation properly. A sound mind always takes sound decision. In a condition of distress, one is very weak, one is dependent on others, one cannot decide what is to be done, cannot opt for any choice. So in such a situation, one gets into the distress, and that is how about the health also, he is unable to take decision what is to be done next. You may have trouble focusing on treatment decisions in such a situation when you come to know about your diagnosis of some serious illness like cancer and that too in advanced stages. You may have trouble focusing on treatment decisions, making follow-up appointments or even taking medicines that are important for your treatment. People might describe distress as feeling, and that is a very bad feeling. You are generally sad, you are fearful, sometimes you are angry with yourself, angry with the God also, angry with everybody, whoever is around you. Why you only? You are so innocent, you are just like others. Others are just enjoying the life and I am here in the deathbed in the hospital. Hopelessness, and in such a situation you go out of control, you can't take decision. Unsure of their faith, purpose or meaning in life. And this is where the spirituality comes into the effect. When something really dreadful happens to you, you don't believe in God. You may believe, but then you start questioning whether God is there or not. Your faith gets shaken up. Even you just forget what is the purpose of this life. I'm going to die like this, miserably, such a miserable death. I've got few weeks, few months in front of me. So these are the conditions. That is what happened in distress after the disclosure of a very bad diagnosis. And then what happens? They want to pull away from people. They want to remain lonely. They don't want to talk to others. They want to get inside themselves. Because basically they are concerned about their illness only. What is going to happen and how is he going to face the situation? Then later on, after a few days, they are concerned about the family's home, social role as a father, mother, friend, caregiver, etc. Daughter is grown up, you want to get her married in a good home. Children have grown up, you want to put them in the colleges. So that whole social problems, they will come in front of you, and if you happen to be the only bread earner, then the problems are too many. And such a situation puts you in a depressed condition, anxious, and you get panicked. When is distress more serious? Distress is always distress, but sometimes distress becomes very serious that you just can't cope up with this. We come under distress number of times. You want to catch a train and you are getting late and you just get caught in a traffic jam. You come under a little anxiety and distress. But sometimes what is going to happen is at the most you will miss the train. That's all, nothing else. But certain distress, sometimes distress can go from an expected level to one that interferes with treatment, makes it hard for you to function or cope and affects all parts of your life. In some cases, a person with distress may have trouble sleeping, eating or concentrating. Some might have frequent thoughts of illness and death, because in such a situation where it becomes dangerous, it goes into a serious stage, then you just think about illness and death only, nothing else. You forget about anybody else. Even you stop taking medicines also. Signs and symptoms of more serious distress: feeling overwhelmed to the point of panic, being overcome by a sense of dread. Dread means what is going to happen to you, you do not know at all. Feeling so sad that you think you can't go through the treatment. You become so mentally weak that such a prolonged treatment, and particularly in cancer, you don't have any capacity to go through it. It lasts for years and years together, I have seen it. Being unusually irritable and angry, feeling unable to cope with pain, tiredness and nausea, poor concentration, fuzzy thinking and sudden memory problems. Then again you start losing your memory. Having trouble sleeping or getting less than 4 or 5 hours of sleep a night because every time you are thinking of death. Having trouble eating for a few weeks, family conflicts and issues that seem impossible to resolve. You think that you are the head of the family, and before you go, you leave this world, you want to settle certain disputes in your family, or maybe that you want to put your children on a path of happiness, path of progress, which you can't do because you have got very limited life with you. Questioning faith and belief that once gave you comfort, and feeling worthless, useless and like a burden to others, because when you are sick, naturally you are dependent on others. You sometimes think that it is better to die because you are bothersome to your family members also. Now, in such a situation, what the patient can do, what the patient should do. Your first line of defense in coping with distress is having a cancer care team you feel safe with. Even if you think your feelings and thoughts are minor, talk to them about how you feel. This is when you talk to the cancer specialist, cancer team who comes to you, but talking to them, I personally feel that psychological pressure will come down. Some of the pressure will go off mentally and you will feel little normal. They can direct you to the help you need. Remember that they are treating you and not just the cancer. In palliative care, generally, why palliative care is different from others? This is the one reason In most of other streams of medicine, they treat the disease, but in palliative care only that we treat the disease also. At the same time, we treat the patient and their family members. This is one important point of palliative care. Remember that they are treating you, not just the cancer, and they count on you to tell them how you are doing and what you are feeling. Remember, no one can do that except you. Stop. Just a simple acronym to think about the distress and how to get relief from the distress. Stop. S-T-O-P. Stop. Do not just react. Do not just react. Stop. This is the S. Stop. Freeze. Do not move a muscle. Your emotions may try to make you act without thinking. Stay in control. So, whatever thought process is coming during distress time, ask the thought process to get away. Just wait. Just think that nothing is going to happen to you. Then T, take a step back. Take a step back from the situation. Get away from the situation. Don't think about what has happened. Don't think about your illness, disease, diagnosis. Take a break. Let go. Take deep breath. Do not let your feelings make you act impulsively. Keep on taking deep breath. You will be able to cool down and you will be able to think better in a wise manner. O, observe. Notice what is going on inside. What is going on inside? What are you thinking? And outside around you, what the relatives are thinking, what the doctors and nurses are doing about your case. What is the situation, overall situation? What are your thoughts and feelings? What are others saying or doing? Now, by doing this, when you start observing the people, automatically you put less emphasis on your inner thoughts of distress. Oh my God, this is going to happen to me. Because now the thoughts process has shifted away from you. Now, when the thought process has shifted away from you and your mind is little calm, proceed. Think further about your own life. Act with awareness. Act with awareness. You are in control. May not be full control, but at least you are in little control of the present situation. Act with awareness in deciding what to do. Consider your thoughts and feelings, the situation and other people's thoughts, and think about your goals. Ask wise mind which actions will make it better or worse. STOP is the acronym which asks you to stop, think about it, get away from those dreadful thought process, observe the situation around and take control of the situation, and then think what is to be done next about your present situation. What the caregiver can do. You already know what is a caregiver. Caregiver means those people who are surrounding you, who generally stay with you 24/7, day and night. They are the people who are socially, emotionally attached with you. They are called caregivers. They are basically family members and friends only. Of course, they have been given basic training, basic nursing training. If you are a loved one or a caregiver who is feeling distressed, it is okay to let the cancer care team know that you need help. Even though most of the information here may seem like it is for the person with cancer, it can also be useful to their loved ones and caregivers. These people are a strong source of support and their well-being is important too. No, the second part we discussed about distress. From distress, what happens? We come to denial, ostrich mentality. No, 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 this cannot happen to me, this cannot happen to me. What is denial? It's a common defense mechanism, psychological anesthetic to an otherwise unbearable reality. and the psychological shock broker that allows us to suppress mentally what we cannot accept emotionally. It is not denial, it is just very selective about the reality I accept, the cartoon sage. Now, why to handle denial? Why? I discussed with you earlier also that denial needs to be broken. If we want to suggest or find out or select a treatment plan, then we got to tell the patient that this is with you, this is your diagnosis, and this is our treatment plan. If he accepts it, then of course we can do it nicely. If he does not accept, then naturally doctors or nurses can't do anything about it. Patient has to be supportive in treatment. If he does not support, nothing good can come out of the treatment. Denial, it's an unconscious effort. Normally, even in normal conversation also, we generally make use of no, 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 na, मैंने ऐसा नहीं किया, no. No negative thing is just coming up. So in such a dreadful situation, the denial is a defense mechanism, it comes naturally. Suppression, which is a conscious or semi-conscious process and is directed to an intra-psychic event. Avoidance, where the patient knows but makes a voluntary effort to shun any circumstance that will remind him, because it's very unpleasant to hear about such illness. So, you just take a decision. Firstly, it is unconscious decision, and then it is a conscious decision that no, this thing cannot happen to me. But I said earlier, denial needs to be broken. Denial cannot get you very far. If you want real treatment and if you want to get well and go back to your home, the normal treatment plan needs to be followed, and that is where your acceptance and proper support to the medical team is very important. How to handle denial? Firstly, we must understand it's a coping mechanism. There is nothing wrong if somebody says, I'm okay, nothing has happened to me. It's just a psychological defense mechanism, so nothing wrong about it. Take it coolly, casually. It has varying effects on the person. It may reduce anxiety and promote optimal functioning. It may also result in excessive delay in seeking and complying with medical treatment. So, initially if somebody denies for a couple of minutes or for a day, it is okay. But he is persistent about his denial, then it may result in excessive delay in seeking and complying with medical treatment. Because he keeps on denying it, he is not supportive. Nodal points that trigger denial: when does the patient resort to denial? Diagnosis. When you inform the patient about the diagnosis, because this is what has happened to you. Recurrence of the same disease, like you are suffering from the cancer, it was okay, properly cured, but again after 4 or 5 years recurrence takes place, then again you start denying it. Termination of treatment, when treatment is being terminated, and normally when do we terminate the treatment? Because then end is nearer, there is no requirement of treatment. Metastasis, when the cancer spreads all over the body, all the organs of the body. Death of other familiar or similar patients, somebody very close to you, maybe your spouse, maybe your mother, father, children, some child, if dies, then you generally say, no, my son cannot die. This is what normally we see in TV news, pictures also. When to break denial? Must be broken if it prevents the patient from taking treatment. It must be broken. And I will say rather it is the duty, legal duty of the doctor to break the denial, and the relatives to support the doctor in this particular process. If the state of denial is pushing the patient into doing something disastrous and cannot plan future, it interferes with the personal relationship. This is the time denial needs to be broken. How to handle denial? Gently challenge the denial, very gently with love and care. with empathy. Understand the feeling. Understand the feeling of the patient when he is being told first time that you are suffering from cancer and that too of advanced stage. So slowly with love speak to him, yes, this can happen. I understand your situation. But then we must know that this is a situation, this is what our diagnosis tells us. Explore reasons. Why is denying? What is the reason? Discuss consequences. Whatever reasons he gives, discuss about the consequences. And one most important consequence is that we cannot treat you then if you do not cooperate with our treatment. Keep a gentle pace. Do not hurry up. Do not hurry up. Such decisions cannot be hurried up. After all, we are talking about life and death of the patient. A doctor is worrying about the treatment plan, but patient is worrying about the life. What is going to happen. Even some patient is strong. He may not worry about his life, but he is worrying about his life, wife and children. What is going to happen to them? Who will feed them? How will my children educate? And therefore, very tolerant, gentle pace is required when you discuss with the patient. Remember, it is a coping mechanism, defense mechanism. So there is nothing wrong if patient is denying, and therefore handle him nicely, gently. What is the skill? Set the scene. Active listening, listen to the patient every time whenever he is saying anything. Be aware of strengths and weaknesses and think creatively within the system. Active listening is required. You should avoid poor listening because you are in a hurry, doctor is in a hurry, he just wants to break the news and get away from the scene. No. Such a disastrous news when you give, you need some time. Spacing out, word listening, selective listening, self-centered listening, judgmental, patronizing, moralizing, philosophizing. This is all reasons of poor listening. You must have learned in the lecture of active listening. This is the poor listening. That you don't want to listen to the patient, you don't have time. You are giving certain signs that you don't have time. You are self-centered, judgmental, and you demoralize the patient with such poor listening. In such stress, denial, again family is the best support. It's a family together, along with the doctor, must tell the patient that this is the reality, this is what has happened to you, this is the disease which needs immediate treatment. And if you don't go ahead, then it might prove little disastrous. The outcome will be detrimental to our health and to your life also. This good staff-patient communication, good staff-patient relationship, and patients to have some control over management of their illness, and therefore one should deal gently with such patients who are denying about the disease. Thank you.